10 signs that could indicate that you have fatty liver disease. Hi everyone, it's Dr. Derek here. So if I was to ask you how much you know about fatty liver disease, what would you say? Because this is a condition that very few of the patients that come to my clinic understand. Now, to explain it all in simple terms, this is when the fat deposits into the liver to a degree which can affect how the liver functions. Here is why this condition is important. Studies such as this one here by Brent et al. Have shown that fatty liver disease will become the leading reason for liver transplants in the next decade. The annual economic impact of this condition has been estimated in recent studies at 103 billion in the US and 35 billion in the UK, Germany, Italy and France combined. So let's dive straight into our 10 signs of fatty liver disease. And if you stay around till the end, I'll let you in on the secrets of what you can do to reduce your risk of getting this condition. Let's start at number 10. This is a dull or aching pain, particularly in the top right hand side of the abdomen. As you can see here in this picture, this is where the liver is located. Any inflammation here will irritate the nerves in this location, leading to pain. Next up in number 9 is jaundice. This can be seen in liver disease by the yellowing of the skin and also sometimes the yellowing of the white of your eyes. This yellowing is caused by a colored compound known as bilirubin. Jaundice occurs when the liver struggles to process this bilirubin, leading to its accumulation in the bloodstream and causing the yellowing of the skin and of the eyes. Number 8 on our list is the feeling of extreme tiredness or fatigue. And the liver has a major function in making sure that substances that aren't meant to be in the body shouldn't be there and that these are gotten rid of. You can call it your very own detox machine. Now, when fatty liver disease progresses, causing end-stage liver disease, the liver can't do this detox process at all. You then get the buildup of things in the body such as ammonia, which could affect the central nervous system, leading to fatigue. This buildup of toxins in the bloodstream is also one of the reasons for symptom number 7. This is a generalized body weakness. Symptom number 6 on our list to look out for is weight loss. Now, the liver is involved in the storage, production and release of vitamins and minerals into the blood. A reduction in this function, especially those functions involved in digestion and nutrient absorption, will over the long term result in weight loss. In addition to all of this, liver disease can result in levels of our hunger hormones such as leptin being abnormal. This can therefore suppress the feeling of hunger and also increase the amount of energy the body uses up. Okay, so we're now in the halfway stage as we get down into some of our more important symptoms that you should be aware of. Easy bruising is at number 5. This occurs because one of the liver's functions is to produce platelets. Now, platelets basically form a plug and reduce inappropriate bleeding in our blood vessel. When the function of the liver in producing these platelets is reduced by severe fatty liver disease, the liver can't really perform this function very well. So these platelets that are essential for blood clotting are reduced in number. That leads to a higher chance that you bruise more easily. Number 4 and number 3 on our list of symptoms are signs of excess fluid presence. This could be fluid that builds up in your legs or ankles, which your doctor will refer to as pitting edema. Or this could be fluid that collects in your tummy, which your doctor will refer to as ascites. This fluid accumulation happens because when your liver doesn't work like it should, pressure builds up in the main vein that supplies the liver. This extra pressure blocks blood flow to the liver, causing this fluid to build up. It also affects surrounding organs such as the kidneys, affecting their ability to get rid of this fluid. As a result of this and over time, this fluid leaks out of your veins and collects in your tummy or other parts of your body such as the legs. Number 2 on our list is itching. This is once more caused by the buildup of toxins in the skin surface, which is caused by the liver being unable to do its job as a detoxifier. Last but not least is number 1 on our list, and this is no symptoms at all. Now, studies have shown that although fatty liver disease affects 25% of people worldwide, the vast majority of patients with fatty liver disease will have no symptoms at all. A lot of people who have early or mild fatty liver disease may not have symptoms, but we see this as the disease progresses towards end-stage liver disease. So studies have shown how this condition of fatty liver disease has become increasingly common due to the increasing prevalence of obesity within our communities. So, what can you do to reduce your risk of this condition? Well, the great news here is that everything is within your power. You can control things like losing weight by taking up a healthier diet and also increasing how much exercise you take up. Reducing things like excess alcohol intake to less than the 40 units per week advised is also really important to avoid any further damage to your liver. If you have other conditions such as diabetes, it is also important to keep this well under control. So we've talked about fatty liver disease today, but what are some of the clinical signs that may come up with another serious liver condition known as liver cirrhosis? This condition is essentially when liver tissue is replaced by scar tissue. What can you do to avoid this condition? Well, the good news is that I've created this video here. I'll put a link somewhere on the screen. This video will allow you to answer this question. Make sure that you check it out. Please leave a like and subscribe if you found today's video helpful. And remember, I truly care about your health and I wish you the very best.